All right, we're going to talk about the 6 rights. The first right is the right patient. Is this the right patient that I'm giving the drug to? So you want to check the medical record, make sure that you are giving the right drug to the right patient. You want to check the patient ID. If the patient's in a cage, you want to make sure that the cage, the name on the cage, the ID on the cage matches that in the medical record and or on the prescription bottle that you need to give it on. So also check the prescription label. Make sure that that drug needs to go to that patient. The right drug. You want to check what you want to do when you're taking a drug off the shelf in the pharmacy. You want to check the label when you take it off the shelf in the pharmacy. So let's say 500 milligrams of cephalexin. When you reach for that drug, it needs to say 500 milligrams of cephalexin. When you go to count out the medication of the drug, you want to check the label again while you're counting out the medication. It still should say 500 milligrams of cephalexin. And then when you put the drug back, you want to check the label a 3rd time to make sure that it still says 500 milligrams of cephalexin. It's very important that you check labels. Mistakes can happen. Label, label, label. Never put a drug down without labeling it and move on to something else. You always want to complete one task. So if it's drawing up a bunch of medications, you want to drop one medication completely, make sure it's labeled and set aside before you draw up another one. Mistakes can and do happen. The 3rd one is the right dose. Did you do your math right? Does that dose make sense? A 5-pound dog does not get 500 milligrams of cephalexin. If you calculated a dose and a 5-pound dog needs 500 milligrams of cephalexin, you might want to recheck your math. Have somebody recheck it for you. Use your common sense, okay? Also check the medical record. Maybe there's a mistake when it was written in the medical record. Use your common sense. If I can make sure that I get that across to you, that's one of the things I want you to understand the most. Number 4, right time. Is it the right time to give this drug? Do you need to give it twice a day, 3 times a day, 4 times a day, or once a day? Check the medical record and check the prescription label. That will tell you when the dose is, when the last time it was given, and when you need to give it again. The 5th one is the right route. Do I need to give it PO? Do I need to give it IV? Do I need to give it IM or sub-Q? Okay. Am I using the right technique? Obviously, if it says that I need to give it IM, I can't give it IV or PO. I need to make sure I'm using the right technique. If I'm giving a drug IV, do I need to give it slowly? Can I bolus it? Okay. If it's a PO drug, do I need to give it with food or without food? These are the things we need to know for the right route. And the 6th one is right documentation. You want to make sure that you document when you gave the medication immediately after you've given it. You need to make sure that you include the drug and the dose that you administered, the time and the date that you gave it, the route and the site that you gave it. So if you gave it on the left cephalic, you need to make sure you write that down. The patient's response, if there was any, okay, and then your signature. So, the 6 rights: right patient, right drug, right dose, right time, right route, and right documentation. This is something that you're going to need for the rest of your career. Need to remember the 6 rights.